I want to talk a little bit more about this Dr. Husel Ohio trial. Not the trial so much, but a little bit more of the details about what hospice care is and what palliative care is, okay? So with this trial, I made a post earlier that you can look about the Ohio trial. A lot of people are, some people call him murderer, things like that. I have no idea if he murdered patients or not. That's why it's going to trial. That's where it's going to be worked out to decide if he committed murder or not. That's the whole point of going to trial. So whether he committed a murder or not it's independent if the medications he gave actually killed the patients and didn't just hasten their death through the double effect, which I explained in that video. Please go watch that if you haven't seen it. Prove the intent of homicide. If he didn't intend to murder them, then it would be manslaughter if those medications caused their death. Again, I'm not a lawyer. I'm going to set that discussion aside. Let's talk about hospice care and palliative care. I'm going to give two examples to explain hospice care and palliative care. So let's say we have a 70-year-old man who has pancreatic cancer with a poor prognosis, what we would call a terminal prognosis, meaning he's not going to survive this diagnosis of pancreatic cancer. So rather than pursuing care like chemotherapy and things like that, he decides to go on hospice, where we focus on his comfort, the comfort of the days that he has remaining. And he may have hospice home care where he is there. He may have a nurse that comes and visits him, and he can have pain medications that are given to him for comfort so that he does not suffer as he dies. That's hospice care. Now let's take a 70-year-old man who is totally healthy. And let's say he has a urinary infection and he goes to the hospital and he gets super, super sick. He gets septic, meaning that infection goes to his bloodstream. And then he goes into multi-organ failure. His heart stops pumping well. He's on many medications to keep him alive. He has to have dialysis. Now we take this man who was previously healthy and now he's in the ICU. He's on dialysis, he's on full support, he's intubated with a breathing tube, he has all these things. So his prognosis is poor. He doesn't have a terminal diagnosis, but he has a very poor prognosis and he's not likely to survive. Now that person, as an ICU physician, or ICU care team, we would continue aggressive treatment to keep him alive. There may come a point where we talk to the family, maybe it's appropriate to go to comfort care, where we stop the aggressive care and we focus on relieving his suffering by giving medications, continuing medications to help his suffering so he doesn't suffer as he dies. That's called comfort care, and that's called palliative care. This Dr. Husel, this was palliative care. From what I understand from the limited information, there were patients that were already dying that he provided medication so that they would not suffer. So those are the main differences between hospice care and palliative care. You need to understand these two before even understanding this case.